how can a simple, everyday meal, something like an undercooked hamburger, actually lead to a life-threatening kidney crisis in a child? It honestly sounds like the plot of some wild medical thriller, but it is a very real, very serious condition that pediatricians are battling all the time. So today, we're going to unravel this medical mystery and see exactly how the food we eat can kick off a literal microscopic battlefield inside our bodies. We are talking about hemolytic uremic syndrome, or HUS for short. This is an incredibly complex illness. What happens is an acquired bacterial toxin basically hijacks the body's own healing mechanisms, and it does this to completely shut down the kidneys. Let's dig into exactly how that happens. Here's a quick roadmap for this explainer. We'll start with a brief look at the genitourinary system baseline. Then we'll introduce the actual threat of HUS and its triggers. After that, we'll zoom in on the microscopic chain reaction, break down the diagnostic triad, cover the symptoms, and finally, look at how medical teams actually step in to manage the crisis. All right, Section 1, the genitourinary system, setting our baseline. To really grasp this disease, we've got to understand the baseline first. Now, the human kidney is just a remarkable organ. We all know it's responsible for filtering blood, removing waste, and maintaining our fluid balances. It does this by taking in a massive amount of blood flow through a really complex network of arteries, filtering all of it through the cortex and medulla, and then sending the waste out as urine. But to see where HUS actually does its damage, we have to look much, much closer. Zooming way in, we find the nephron. This is the microscopic filtration unit, and we've got about 1 million of these in each kidney, which is wild to think about. Right at the top is the renal corpuscle, and inside that is a delicate little cluster of capillaries called the glomerulus. It's right here in these incredibly small arterioles where the blood gets actively filtered, and sadly, it's exactly here where the devastating battle of HUS goes down. Moving on to Section 2, the threat of HUS. So what is it? Hemolytic uremic syndrome is an uncommon but super acute renal disease. It strikes out of nowhere, and it's actually one of the most frequent causes of acquired acute kidney injury, or AKI, in young children. Now, while technically anyone can get it, it primarily targets infants and small kids, usually between the ages of 6 months and 5 years old. But you're probably wondering, what actually triggers this sudden attack? Well, the vast majority of these acquired cases are caused by one specific culprit, an enteric infection of the E. coli 0157H7 bacteria. This specific strain produces a really potent exotoxin. And the scariest part? The environmental triggers are usually just everyday things. Lots of cases have been traced back to undercooked meat, especially ground beef, hence the hamburger we mentioned earlier. But it's not just meat. It can be lurking in unpasteurized milk or fruit juice, like fresh apple juice. You can find it on alfalfa sprouts, lettuce, or even in sewage-contaminated water that a kid might just accidentally swallow while swimming. Section 3, the microscopic chain reaction. Okay, so let's say a child ingests the bacteria. Usually, they'll just get what seems like an initial stomach bug. But then that E. coli exotoxin enters the bloodstream and it kicks off this crazy microscopic chain reaction. Step 1. The toxin travels straight to the endothelial lining of those tiny glomerular arterioles we were looking at. It attacks those delicate inner walls, causing them to become super inflamed and significantly swollen. And here's where a brilliant biological defense mechanism just tragically backfires. Because that vessel wall is damaged, the body does what it's supposed to do. It sends in platelets and fibrin clots to patch it up. But this intravascular coagulation essentially creates a massive microscopic traffic jam. The vessel just becomes totally blocked up with these sticky deposits. Now picture your red blood cells trying to flow through this tiny, swollen, clotted up tube. As they attempt to literally squeeze past these partially occluded blood vessels, they face extreme mechanical trauma. The red blood cells are quite literally damaged, fragmented, and shredded, just trying to force their way through that traffic jam. Which brings us to Section 4, the diagnostic triad. This specific microscopic pathology leads us directly to the single most important clinical takeaway of this entire condition. Seriously, if you remember nothing else from this explainer, remember the number 3. There are 3 core pillars that perfectly define the cascading effects of HUS. The internal microscopic damage directly creates this diagnostic triad. Pillar 1 is hemolytic anemia. Why? Because those shredded, damaged red blood cells we just talked about are recognized as broken by the spleen, and the spleen systematically removes them from the blood. That drops the red blood cell count drastically. Pillar 2 is thrombocytopenia, which just means severely low platelets. Why does that happen? Because all the platelets are being consumed and clumped together in that microscopic traffic jam trying to heal the vessels. And pillar-free is renal failure. Why? Because those glomerular arterioles are completely blocked off, which abruptly halts kidney filtration and causes acute kidney injury. So, anemia, thrombocytopenia, renal failure. That is your classic triad. Section 5, Spotting the Symptoms. Now that we know exactly what's happening on a cellular level, let's connect it to what the patient is actually experiencing on the outside. The internal pathology completely dictates the external symptoms. Because the child has severely low platelets, they easily develop hemorrhagic manifestations. You're going to spot unexplained bruising and petechiae, which are those tiny pinpoint red spots right under the skin where little blood vessels have burst. And because the red blood cells are being destroyed, leading to that severe anemia, they're going to present with marked pallor. They'll look extremely pale and totally washed out. The sudden onset of these symptoms usually follows a bout of gastroenteritis. And the full clinical picture here is severe. We're talking bloody diarrhea and vomiting. The child might be highly irritable or, conversely, incredibly lethargic. Because the kidneys are actively failing, you'll see oliguria, which is very low urine output, or even anuria, meaning no urine output at all. In the really severe cases, the toxins and uremia can even start affecting the central nervous system, leading to seizures, stupor, coma, or even signs of acute heart failure.
Section 6, Medical Management and Rescue.
Seeing a child present with this triad is an absolute critical emergency. And because HUS is driven by a bacterial exotoxin, there's no magic pill you can just give to instantly cure it. The main goal of therapy here is early diagnosis of that triad, followed by aggressive, highly structured supportive care. Medical teams are essentially putting the body on life support while it clears the toxin and heals itself. This means precise IV fluid management, escalating to dialysis for severe renal failure, and utilizing very, very careful blood transfusions to combat the severe anemia.
The nuances of treating this are incredibly high stakes. For example, if a child has been uric, meaning they've produced absolutely zero urine for 24 hours, or if they have low urine output combined with uremia and hypertension, hemodialysis or peritoneal dialysis has to be immediately instituted. They have to step in and do the filtering work the kidneys just can't do right now. Furthermore, while the child desperately needs red blood cells for their anemia, blood transfusions using fresh, washed packed cells have to be administered with extreme caution. Think about it. Since the kidneys aren't filtering fluid properly, pumping in too much volume risks a massive fluid overload, which can lead right into acute heart failure. The team might also use advanced treatments like fresh frozen plasma and plasmapheresis to help clear the plasma.
It really is a terrifying cascade of events stemming from just a microscopic toxin. But the good news is survival rates are actually very high when it's recognized early and supported aggressively. Which kind of leaves us with a final thought. Could a deeper, everyday awareness of food safety, like simply making sure we fully cook our burgers, combined with a rapid clinical recognition of that diagnostic triad, permanently end the severe threat of HUS in kids? Understanding the science is absolutely our first step toward prevention.